specifically we asked them, in this last month, how many of you had 4 or more days in which you felt your mental health was not good? And 23% reported that they felt like they had 4 or more days on which their mental health was not good. This was interestingly also a 2% increase from 2007 to 2011.
That should not surprise you, right?
It does not surprise me. Things are stressful now, and you see that in folks, and
right.
so no, that is not surprising. But I like this because instead of me assuming that's how people are feeling,
Good.
They're telling me that's how they're feeling. That's a lot more reliable than, I guess, my perceptions of things. I trust that more.
Right.
So yeah, not surprising.
Let me interrupt here. Availability of services under healthcare access.
Yes.
Demand was highest for depression, anxiety, emotional problems. Now see, I would have, again, my own thinking, would have said, well, maybe alcohol abuse or addiction would have been, but it's not. That's actually a much lower percentage.
Yes, it is a much lower percentage. Now, there's a couple of things we should take into consideration. If I'm addicted to a narcotic like heroin or cocaine or methamphetamines, am I, number one, going to have a residence at which you could send me a survey?
Okay.
Less likely.
Okay.
And am I going to have, I guess, maybe the desire and the ability to sit there and fill that out and send that in? So we're probably, for the drug use issue, underreporting more so than many because we just don't capture them as well with a paper pencil survey. But I look at the mental health and the emotional problems and the substance use problems. The fancy term is comorbid conditions, but the same underlying problems often contribute to mental health problems as well as to substance use. They often go hand in hand. Sometimes people are self-medicating for mental health problems. And so I think that's something that can guide us as maybe trying to, across the board, look at what are the reasons, what's below these trends that are troubling us, because that allows you to get more bang for your buck. If we get to the bottom of things, then maybe, just maybe, we can move everything in the right direction.
Healthcare coverage, we're going to move right along here this morning. Healthcare coverage, any surprises there?
No, we saw an increase in Huron County residents who were uninsured. It rose from 8% in 2007 to 11% in 2011. Given that over half of our residents get their insurance from an employer, given how much unemployment we've seen since 2007 when we did it the last time, it's not surprising to me. It is troubling because that we can see that one good example is prescription drugs that got filled. So your doctor gives you a prescription. A third of our people had gone in the last year without filling a prescription. So, and we found that that was 71% for those without health insurance coverage. That's really a problem because the doctor thinks they're treating you, and you're not getting treated in the way the doctor thinks you're getting treated. So I think it's really important for people to communicate with their physicians. I'm lacking prescription drug coverage. I can't afford that prescription. Can I work with a drug company to get that done? Or can we look at another way to treat this
problem? So there are some options.
It is important that their physician be part of that discussion instead of them being embarrassed and just taking it upon themselves to say, I'm going to ignore this. Because then you and your physician are not on the same page for treating that problem.
Very good. Okay, we're going to take a break here at about 26 after the hour of 9 o'clock, and we're going to come back with Angie, and we're going to talk about some particulars, and we'll do that as Wednesday Morning Live continues.